Hello, Black Pitch Contest. Very briefly, by way of introduction, I will say my name is Ozzy Jones. I am a Black female Canadian entrepreneur who is the current founder and owner of the Onyx Clinic. By background, I am Caribbean Canadian, but there is intersectionality there. My father is from Nigeria, actually, and my mother is of Jamaican descent. And I've always had a passion for empowering my community and seeing my community succeed in whatever ways that it's possible. And with that, building out the Onyx Clinic, my desire is, to establish the 3 pillars that I have founded in my mind for the Onyx Clinic, which essentially is education, advocacy, and community. And using those 3 pillars, my hope and my aim is to establish a space, a virtual learning space where through the use of conversations and through interviews, I would be able to raise awareness across racialized communities upon within some of the idiosyncrasies and challenges that I've become more aware of through my own studies and my own experiences. So growing up for me in the low SES housing community in Toronto, I had limited knowledge of professions like speech-language pathology. And so there were a number of challenges that I faced along my journey. But, I am happy to say I'm one of few Black speech-language pathologists here in Ontario. And, I was able to not only provide, open up my own private practice, the Onyx Clinic, which I did just about over 6 months ago. That gives me the opportunity, of course, to be able to reach racialized communities and offer them the opportunity to have a clinician or a therapist who looks like them. And this is feedback I've received, that they're happy to see a clinician that they can connect with, who they do feel a bit of an immediate comfort level and trust with because of shared culture, shared language, dialectal variations, that sort of a thing. And that is a great feeling, and one that I think that, all individuals should have the opportunity to have access to. But I also had the opportunity to do some other further education and obtain a master's in health management through McMaster University. And through that work, looking at health systems, health policy, I was able to dig in a bit deeper and learn about some of the what's called race-based medicine, and so some of the systems and processes that are embedded, entrenched in our healthcare system that I, was alarmed about, and truly wanted to be able to sound that alarm and let, everyone in our community know about some of these challenges that we walk into every day, and we don't know when we go to the hospital for acute care and to emerge, or, we go to our GP. And so, like I said, the 3 pillars that I have is community, advocacy, and education. And so my hope is to be able to use conversations and use interviews to be able to showcase some of those challenges, some of the practices that are embedded, sort of raise awareness for viewers, and then be able to provide some evidence-based methods on how to effectively navigate the system in hopes to train or equip members in our community to be advocates, to advocate for themselves and to advocate for their family members. And so, the model is, I think, quite unique because, I'm not necessarily going to be selling something. Sure, I'm selling speech and language services. I certainly am. I do have that as a service to provide, but I want to be able to build out this virtual space and utilize the funds from the Black Pitch Contest to be able to not only invite other healthcare professionals in that intersect in their work with a speech-language pathologist. We work in hospitals and schools and in our own independent clinics, but also, the hope is to utilize the funding to be able to build out the preliminary draft, or look at an app that would do exactly what I've outlined, and that is, to be able to provide users of the application with some of the education pieces around, what are some of the algorithms that we need to be aware of, what is some of the wording that we need to be able to utilize when we get into these spaces, and then be able to provide evidence-based methods for users on site and in the moment that they can access and be able to advocate for themselves or their loved ones. I'm hopeful, when I think about the impact that this will have on our communities. I think it's quite huge. I can't tell you the number of conversations I've had with friends, family members, strangers about, having their own, intersections with the healthcare system and the challenges that they faced, and me having a bit of knowledge about what that system looks like and some of the idiosyncrasies within the system. I raise my voice and say, well, did you ask this, or were you offered that service? And a lot of the times the answer is no, or they just didn't know to ask. And because of that, there's definitely a gap and a dearth in what racialized communities actually receive from the system. And so the impact, I think, can be quite huge. I think it can result in better quality of life. I think it can result in saved lives at sometimes. I think it can result in saved money, saving time, and getting people the help that they require. I also hope to build out a database of Black healthcare professionals. My vision is to build out, to hold interviews with surgeons and GPs, with other allied health members like social workers or dietitians or physiotherapists, and to talk through some of the, like I said, the challenges and evidence-based methods to navigate the systems from their perspective. I've started, I'm currently working with my professional organization where we're just doing some preliminary interviews with other speech-language pathologists for Black History Month. So it's sort of a proof of concept where we will be launching, 1 or 2 interviews at the end of this month that we're holding with other speech-language pathologists. And I'm hopeful to have the funds and have the means to be able to expand this and really realize the vision that I hold for the Onyx Clinic. So in conclusion, I hope that overall, the information that I've been able to share in a very brief video here provides you with just a look at, my passion for the ability to be able to share the knowledge that has been imbued to me with those in my community, in the hopes of equipping people to be advocates for themselves and for their loved ones through the healthcare system. I'm hopeful that this video pitch, as well as my written application, which goes into a little bit more detail around the vision for the interviews, as well as my vision for the application build, will be sufficient and provide you with the information necessary for me to move on to, I don't know if there's another round for the contest, but thank you so much for the opportunity to provide you with this pitch for the Onyx Clinic, and I do look forward to hearing from you again very soon.